6 to 80. I actually practice on Divine Street, the stone's throw from here, 2 blocks up from 5 Points. And so all of you are kind of in a planning stage right now. And there was a wise king that once wrote in a proverb. He said, "A man will plan his ways, but it is God who directs his path." Now, I thought about that proverb when I was reading one of these questions that Graham gave me. It says, if you had it to do over again, would you pick the same profession? I was watching. That's a complicated question to dissect. No pun intended. But I was watching TV this afternoon, laying on the couch, and there was a movie on called 17 Again. Have y'all seen that? With Zac Efron and Matthew, what's the Friends guy? And there's been several movies from Hollywood that talk about getting a second chance at life. One of them is It's a Wonderful Life, with Jimmy Stewart. Do y'all go back to that one? And even the one with Tay Leone and Don Cheadle, Family Man. Have y'all seen that one? Great movie. But they all talk about, if I could get a chance to do it over again. But knowing that there's someone that is directing my steps, the short and simple answer to that question is, I would do the same thing again. I would have to. Because if I didn't feel that there was someone, a hand of providence on me, moving me and directing me, then I would really feel ill at ease. I was telling Graham we have a dental study club that meets once a year at a different place, probably within a couple of hours of here each November, for the purpose of continuing education and just getting families together. This year we had 30 dentists and our spouses that met, and on one of the nights we went out to eat, and a dentist from Greenwood, a young dentist, because he's not young to y'all, he's probably 40 years old. I was sitting by him and I said, I have a son who's actually a 4th-year dental student right now, Kevin, who's down in Charleston. And I said, I was telling this dentist from Greenwood that, people will ask me, is he enjoying dental school? And I'm kind of like, how can you enjoy dental school? It is so difficult, and it's not an experience you want to go through again. And this dentist from Greenwood, who's actually married to a pediatric dentist, who's the only pediatric dentist in Greenwood, said, he laughed and said, but, going back a little bit, I said, but I look back on that experience of dental school, and those 4 years, really, because of the relationships that I developed, one was Graham's dad, Rick, and just the experience I had, was probably the best 4 years of my life. And yet, the worst 4 years of my life. And he said, this dentist in Greenwood, getting back to him, he said, out of high school I went into the Navy. He said, and for 4 years every day I would look and see how much time I had left. He said, I hated it. He said, but I look back now and those were the best 4 years of my life. So that's a complicated unraveling of that question. Would I do it again? Absolutely. But it's not something, medical school, dental school, it's not something I think you could do twice in a lifetime. But with that, let me tell you a little bit about dentistry. And most of you, all of you know about dentistry because you've been to the dentist, had your teeth cleaned, and maybe a filling here and there, or been to the oral surgeon. But I'll start in talking about maybe how, as a dentist, I relate to medicine. And just this past week, my relationship with physicians in town, I had a patient come in, and she was 4 months pregnant, and it was the first time I'd seen her, and she had some decay that was significant that I didn't think could wait until the end of the pregnancy because it might develop into an abscess, which is infection, could harm the fetus. And so I called her OB and speak to him and tell him what her needs are, and this is what I need to do, and just talk it through with him. And so he gives me a list and it's kind of a standard list, but just to clear it with him, of anesthetic that I might use, narcotics that I can use, and antibiotics. Turns out all I need is the anesthetic to anesthetize her so that we can get this decay taken care of so it doesn't progress any further. That's just a conversation with an OB this past week, and then another patient came in, and when we treat patients that have prosthetic joints or valves, like prosthetic heart valve replacements or hip replacements or shoulder replacements, knee replacements, they have to be prophylaxed with antibiotics because if we're doing something that creates what we call a transient bacteremia, where when we clean teeth or extract teeth or do a root canal on a tooth, we introduce bacteria from the mouth into the bloodstream, and that bacteria can then lodge around the hip or the knee or wherever the prosthetic valve is. And so we need to prophylax them with antibiotics. And the standard is, like, if you're not allergic to penicillin, 2 grams of amoxicillin an hour before the treatment. And so this lady comes in, and we get a review of her medical history, and she's got a plate in her foot. Well, that's not a joint replacement. If it's a joint replacement, I know I just need to prophylax them. So I get on the phone and talk to the orthopedist and find out, is this something, she's got this plate with these screws in there, is this something that we need to do? Turns out he had it been 2 years earlier, he would have wanted her prophylaxed. But just a communication with physicians that I had last week. Another common one for me as a general dentist is patients that might be on a blood thinner, like Coumadin or Xarelto is the new one you see on commercials now, and need to know what their INR is, their international normalized ratio. Where does it fall? Is it like the standard is like from 2.5 to 3.5, and if it's within that range, then we can go ahead with the extraction, and the clotting factors will be fine. But if not, if they're on these new medications like Xarelto, they're really hard. You can't get a lab ratio that tells you what to do, and so you have to speak with the physician and say, do you have her where you want her? We're going to extract the tooth here, and is it okay, or do you need to regulate her, whatever? So there's as a general dentist, there's 3 ways, 2 that were used this past week that we relate to physicians. It kind of spins me into, and what I'd like to do is talk about in dentistry the different specialties in dentistry, just to give you an idea. And one specialty, oral surgery, is very closely related to medicine. I'd say oral surgeons are properly and aptly named oral and maxillofacial surgeons because they do a lot of facial surgery. A lot of you in here probably have been to the oral surgeon to have your 3rd molars extracted under sedation. And that is probably 70% of what they do is take out wisdom teeth. That's what keeps them in business. But they actually have the longest residency program outside of dentistry. It's a 4-year program. For some oral surgery residents, it's a 6-year program. Their first 2 years, they go back to the last 2 years of medical school and get their MD degree. And then they go 4 years of oral surgery residency. I'm not quite sure why they do that. I have an idea, but I think it just shows you how closely they are related to the medical profession, the medical field. And I know that the oral surgeons here in town are all on trauma call for the hospitals around here. And the trauma that they see is really interconnected and dovetails with ear, nose, and throat surgeons and plastic surgeons, because they will do zygoma fractures and maxillary fractures and all kinds of things. I had an oral surgeon a couple of months ago show me a picture of a chainsaw accident he had to go in to see, where the patient was, the chainsaw had hit right here, and it had reflected back everything all the way back to the ear to where you literally could see the mandible and maxilla just exposed. And so he had to sew him back up. And it was amazing. The guy had a beard and everything when he sewed him back up. You couldn't even tell it. But oral surgery is probably the most closely related to the medical profession in dentistry. They do a lot of hospital work. Pediatric dentists do a lot of hospital work. Pediatric dentistry is very similar to general dentistry. They do probably a lot less in terms of technical stuff than we do in general dentistry, but they have to manage kids. And even though I see kids, I can walk into the room and in 5 seconds tell whether or not I want to treat that child or not, or if I'm going to send them to the pediatric dentist. They just have a special gift. I think it's a calling to be a pediatric dentist, to be able to manage children. And for those children, they do sedation, but for a lot of them, they will take, probably once a month, the pediatric dentist will see their special needs kids in the hospital OR and just do all the dentistry that that child needs at that one time under general anesthesia. So those two specialties, oral surgery and pediatric dentistry, very much related to hospital dentistry. The other specialties, endodontics, it's root canal therapy, and all of these specialties, as a general dentist, I do. Probably the lone exception is orthodontics. Our orthodontics training at MUSC as dental students was almost zero, and so I didn't get much of that. We could do continuing education and put on braces. Probably, I was told by an orthodontist about 10 years ago that over 50% of all braces are put on by general dentists and not just by orthodontists, which surprised me. We do, as a general dentist, do all of the specialties. It's just those complicated things, like those difficult third molar extractions that need a little bit more expertise. Those go to the oral surgeon, and I'll be honest with you, most general dentists don't do third molar extractions. I do a few of them. Endodontics, root canals, something I do, something I really like to do. It's a specialty where the endodontist graduates dental school, does a 2-year residency. Actually, I think the residency at MUSC, they just started an endodontic residency in Charleston, and it's like a 28-month residency, so 2 years and several months. But it focuses mainly on the pulp of the tooth. The pulp